Diversity and Health by Brendan O'Reilly. Introduction. Health among different ethnic groups has been a topic of research for many decades. Healthcare professionals have been trying to piece together why some ethnic groups face higher mortality rates from certain illnesses, geographical circumstances, poverty, empowerment, segregation, etc. Infant mortality rate. For Module 9, I looked at infant mortality rates among whites and blacks in the United States. I found that if divided into two segregated groups, the white infant mortality rate jumps to number 12 among international comparisons, while blacks drops to 26. As you can see to the table to the right, the US white is at 12, and the United States blacks are at 26. This made me ask the question, why is it that the infant mortality rate differs in such a drastic amount while residing in the same country? The table to the right shows that blacks have a clearly high infant mortality rate as those opposed to whites. I speculated that segregation, poverty, and empowerment are key factors in the results of the data. Poverty is the best documented social risk factor for infant mortality. Empirical examples of the relationship between them can be found as early as the first decade of the 20th century. The sheer volume of research supporting a link between poverty or low socioeconomic status and infant mortality is impressive. The access to exceptional health care is merely affordable only with insurance coverage in the United States. The absence of these valuable resources results in minimal care for the mother during her time of pregnancy. This trend causes the fetus to be in an unhealthy state while in the womb and could have a premature birth, making the risk of mortality even higher. It is evident that poverty and high infant mortality rates among African Americans have a direct correlation. The graph to the right shows the infant mortality rate of blacks and the whites having a lower one. Racial segregation plays another vital role in the infant mortality rate among blacks. The mother during the prenatal stage in heavily segregated cities can face many biological and mental harm. The research of segregation's effect on infant mortality suggests that blacks compared with whites are differently exposed to negative macrosocial conditions. Neighborhood deterioration, lack of employment and educational opportunities, loss of tax base. Social and material conditions such as housing and air quality, limited social contacts, loss of community infrastructure, and individual level factors such as less physical activity, inadequate diet, lack of social support, stress, reduced access to medical care, placing infants at risk of dying because of the isolating effects of segregation. Mothers failing to have access to adequate support during pregnancy are facing a higher chance of having an infant that will not survive the first 27 days post-birth. The table to the right shows the relative rate of infant mortality in U.S. cities of 50,000 from 1981 to 1985. Political empowerment. Black post-neonatal mortality rates were lower in cities where African Americans had higher levels of political power, while post-neonatal mortality rates were not affected by the level of black political power. Therefore, black political power led to a narrowing of the post-neonatal mortality gap between African Americans and whites. Black political officials could allocate for their ethnic group to receive the care necessary to help close this gap throughout the nation. African Americans are facing isolation with little representation in the healthcare community to aid in the infant mortality dilemma. The graph to the right shows how far down the U.S. is compared to other developed countries on the scale of infant mortality rates. In conclusion, I found that segregation, poverty, and empowerment play vital roles in the high infant mortality rate among black U.S. citizens. The gap between whites and blacks is one that can't go unnoticed and should be taking steps to narrow it. Isolation in segregated and low income cities are a melting pot for mothers to face less than ideal situations during the prenatal phase. Better access to healthcare and more education on the benefits of good health while the fetus is in the womb will go a long way in decreasing this gap that the nation faces in present day. Narrowing the infant mortality rate among blacks and whites will help the U.S. leap up the ranking regarding infant mortality among other developed countries.